All right, so go ahead and introduce yourself for me.
My name is Brent.
And how long have you been a patient here at Advanced Spinal Care?
About 15 years.
Okay, so you've been coming for a while through the
Yes, I
office
have.
move and all of that. So how did you come across Dr. Lipinski?
It was by chance. I took my family to the boat show. We had actually just moved to the Tacoma area that same year, and decided to take them to the boat show. And there was the booth set up that he was signing up patients to come in. So I was when I first moved here, I was having a lot of problems with degenerative disc disease, and to the point where I'd actually probably that fall had talked to a neurosurgeon and was sort of at wit's ends because I was using a home traction TENS unit and couldn't handle the narcotics because it just grogged me out really bad. So I was looking at possibly, I actually, one of my best friends growing up is a chiropractor, not a Nucca chiropractor, but I'd never been to a chiropractor, ironically. I'd always been fairly healthy, so I'd been suffering from this degenerative disc problem for probably about a year, and had looked at different avenues of trying to get some relief, and then stumbled across Dr. Craig in Advanced Spinal Care, and he's kept me somewhat in correction for the last 15 years.
Wow, it must have made an impact since you've been coming for so long.
Yes.
So tell me a little bit about what you remember about your first correction.
Well, I can tell you that I was having a lot of referred, basically my left arm, I could actually tell that there was I was having a lot of pain, tingling in my fingers, and actually some, seems like muscle degradation, because I wasn't able to do a whole lot. And after my first correction, it's almost like somebody shocked me, and I started feeling more sensation in that arm, and it seemed like shortly after, I think maybe I held for a little bit, but I didn't hold quite as well the first few times, and then they got me in correction, and I was, basically cured, as I say, and the process of the subtle adjustments you get through Nucca. I always joked my wife to say, well, if I wasn't living proof that I was pretty much cured of my problems, I would say he was a faith healer, because he just sort of lays hands on you, and next thing you know, you're all better. So
Wow.
you don't really even feel. I mean, you feel a little bit of a stiffness that evening or the next day after a correction, but no pain whatsoever. So it's pretty miraculous how it's helped my my cervical spine.
So after your correction and after you started holding your correction, is that when you knew that you didn't need the surgery?
Right. Surgery was definitely last resort, and I still hadn't convinced myself. Obviously, the surgeon, he wasn't ready he said, well, when you can't handle the pain any longer, then I'm probably that last option. So he probably was the one that made me start thinking I need to look at what else is out there. I was thinking about acupuncture and some other things when I ran across Advanced Spinal Care. So it was just almost like I'm a religious person, so I was thinking maybe it was God's way of directing me in the right direction.
Yeah. Well, so if somebody else was looking at this and thinking maybe they were facing a back surgery potentially for something similar, what would you tell them if they were kind of a little bit skeptical?
Right. Well, I'm in the medical field, and I know that some people have fairly good results from back surgery, but I think the statistics show that there's more people that don't have good outcomes as compared to others that do, and so I would definitely encourage them to try a non-invasive process like cervical adjustments before they ever decided. And I think that it's definitely there's a cost associated with it, but with the price of healthcare, to have anything else done, it's fairly inexpensive in comparison. So people that get concerned about costs of this, that, and the other, and even I think early on my insurance didn't cover it, so it was an out of pocket, and I would definitely say it's surprising how well it works, and that it would be definitely something everybody who is considering surgery should try before they take that next step.
Definitely, definitely. Well, thank you for sharing your story.
Sure.
Appreciate it.